doing in this network is really bringing the professionals that specialise in nutrition and health together, which has never been done before.
So, well, we have under nutrition nationally, but particularly regionally. So, malnutrition, undernutrition, and overweight and obesity. And we have particular pockets across the south coast of high prevalence of either. We also have a large area of food insecurity and food poverty, which means that the quality that people need they're not getting. And again, there are particular pockets across the south coast. So what we're hoping to do is bring nutritionists and dietitians together to look at a community and a hospital aspect of how we can solve some of these problems together.
Well, the big pillars really that we see across the nation. So we have a high levels of obesity, we have undernutrition, we have increasing cancer diagnosis, type 2 diabetes. All of the big non-communicable diseases are still being seen here in the Wessex region as they are nationally. And we're the first in our region to be able to bring those individuals together to work collaboratively to try and solve really difficult, complex parts of health with a workforce that is really engaged and should be at the heart of all of these interventions.
We see it as providing a more holistic and joined up approach, because we know that a lot of people have the same passions and the same projects, but we have lots of small projects going on regionally and nationally. And what we're hoping to do with our regional model is actually get people to work together to really make impact and improve health outcomes.
Well, there are existing collaborations, obviously, through the Wessex Health Partners. Our collaboration is brand new, which is really exciting as a result of our project. So nutrition and dietetics is often a small world, and you often know somebody, but this is a really new opportunity between the different organisations that we're part of. We've really drawn on the expertise across the Wessex region, whether that is higher education institutions, the hospital processes, the council.
So we've got engagement from senior director level all the way through to newly qualified or undergraduate student professions. So, and obviously the Wessex Health funding is hugely important to that. But also I think because we've got them to take away a toolkit. So when they go back home, they'll be able to reflect on where they're at, what they need to develop their research skills, who they can collaborate with, and how they can take things forward in their action plan. So we've also been very sort of strategic in how we've delivered the day, so they can go back to managers and say, actually, this is the benefit of going to this day and staying in this network.
It's not just a series of talks where you sit and listen. It's real tangible outcomes for people to take away. And in particular, we want to engage in the registered nutritionists and the registered dietitians. We know lots of people work in nutrition research and they are welcome here. But we know that dietitians and nutritionists are underrepresented in our workforce, and we want to galvanise them, and this is a space for them to come into.